Would I get good results from just liposuction of my neck area, or would I need a neck lift to see my jawline again? What are the chances my skin will just hang if I only get liposuction of my neck area? I am hoping to not have to have a neck lift. I am 42 years old, and my weight has gone up and down over the past 20 years due to 4 pregnancies. I am close to my goal weight right now. Does a 42-year-old skin normally have enough elasticity to bounce back from liposuction of the neck?
Thank you for your question. You're 42 years old, and you provide us with a photo of a side view of yourself, and you're stating that you've had weight fluctuations um, related to several pregnancies, and you're questioning whether or not there's a chance that your skin would sag after liposuction, and at the same time you have your trepidations about doing surgery. So certainly I can assist you with this question um, based on my own personal experience as a practicing cosmetic surgeon. A little bit of background: I've been in practice for over 20 years in Manhattan and Long Island, helping people with this very problem. In fact, I'm also board certified in not only cosmetic surgery, but I'm also fellowship trained oculofacial plastic and reconstructive surgeon. So facial rejuvenation is a big part of what I do, and there has been a continuous evolution over time in how we approach situations like yours. So the one thing that cannot be done with just photos is a physical examination. So the question that you start with is your concern about sagging of the skin has to require a physical examination. Basically, a doctor has to be able to tell, does your skin have the ability to retract and go to its normal position? Or will it sag? And if it sags, will it be an acceptable amount of sag? You see, the traditional approach from a surgical point of view has always been to do some type of lift or do liposuction plus a lift. From the non-surgical point of view, thanks to drugs that are injectable to try to melt fat, as well as non-surgical thermal tightening devices, those become front and center to a non-surgical individual. As a cosmetic surgeon and with the practice that I have, I actually offer all those options. So when I look at someone like yourself, I'll just share with you a little bit of personal bias. I tend to be more conservative. I tend not to advocate surgery per se in terms of lifting, although the youngest person I've ever done a facelift for was 37. And a close second, or in that same range, was a woman who was 42. But her face was very jowly and her face was very thin. So there wasn't fat to remove, but the skin was very much sagging. In your situation, an approach that would be non-surgical, that it may be a good first line of therapy, would be possibly a little liposuction to help improve the jowl, as well as a non-surgical skin tightening device. In our practice, we have a laser that actually allows me to treat the skin deeper to heat up the tissue, both the dermis, the backbone of the skin, as well as the deeper tissue, to cause contraction. Now, I chose this device after waiting and figuring out what device would actually deliver what I want and give me still the hand of a surgeon to be able to apply it in a way that makes sense to me. A lot of devices are done by non-physicians, and they basically place some type of connection to the skin and generate heat. And unfortunately, most of those devices have been met with a lot of resistance from patients because of undesirable pain as well as unimpressive results. But in my hands, I've been happy with this particular modality. Last but not least, there may be opportunity to add filler in a strategic place in order to create a jawline effect using something called structural volumizing. So there's an art. There's an art to doing this and approaching this, and it's never black and white, but does require a physical examination. I recommend you meet with several doctors. I would recommend you meet with surgeons who offer a lot of different modalities in their office, just so that you minimize the bias, and see who you're comfortable with and figure out what works for you. One of the things that I always tell patients who are considering a limited surgical option or a non-surgical option is it's a relatively low risk, and then you can always do surgery at a later time. So I hope that was helpful. I wish you the best of luck. Thank you for your question.